Hello, my name is Chelsea Isles and I'm a fourth-year medical student at Ohio University Heritage College of Osteopathic Medicine, and I'm the primary investigator for this project, Program Evaluation of an HIV/AIDS Educational Intervention in Cariamanga, Ecuador. This project is a subsection of the findings from our research group's larger HIV intervention research. This intervention was carried out in response to previous data in the area showing an inverse relationship between HIV knowledge and HIV stigma. CDC methodology was utilized for the framework of this program evaluation, as you can see in Figure 1. The main components of a program evaluation include evaluating the process and the impact of such an intervention. Data was collected through the various instruments outlined in the methods, including anonymous surveys, analyses, and audio-recorded de-identified interviews. A logic model, as seen in Figure 2, was implemented to outline the various steps of our process and impact evaluations, such as to measure and organize what went into the intervention, what was done at the intervention, and what came out of the intervention to lead to the impact that was found. For the program evaluation, it is important to consider 6 specific aims, the first 3 of which address the process and the last 3 address the impact. Aim number 1, investigate and evaluate whether the intervention is carried out as it was intended. Aim number 2, the efficiency of the intervention. Aim number 3, the cost effectiveness. Aim number 4, the overall effectiveness in achieving its goal. Aim number 5, the impact attributed to the intervention itself versus any outliers. And aim number 6, to provide feedback, recommendations, and aid in the development of future community-based health interventions in Ecuador. We will now briefly address each of these. Aim number 1, was the intervention carried out as it was intended? For the most part, yes. Our goal was to deliver a culturally appropriate and community-based educational intervention. We maintained our goal of having native Ecuadorian facilitators who spoke the local Spanish dialect. Administrators who did not speak fluent Spanish did undergo an intensive Spanish course prior to implementation. All advertisements and locations of the intervention were local and in the town center for the ease of access of participants. Of note, there were not always native-speaking health professionals at each intervention. Aim number 2, efficiency. As you can see by Figure 3, efficiency did improve as interventions went on with more practice. This is expected for any pilot intervention, and now that the materials have been developed, there will not be the need for an extended development and funding period that was done previously. Aim number 3, the cost effectiveness. As an international research project, the cost for this intervention exceeded $9,000, but as a community health intervention carried out by local public health groups, we anticipate the cost to be anywhere from 28 cents to $2.78 per person, dependent on whether food and beverages will be provided. Aim number 4, the overall effectiveness in achieving its goal. This pilot intervention was effective in its goal of increasing HIV knowledge and decreasing HIV stigma on a short-term impact basis, as you can see by Figure 4. Both were statistically significant with a p-value less than 0.001, and there was a reported 100% satisfaction with the intervention by the participants. The participants' most reported favorite aspect of the intervention was learning about the virus and prevention of HIV. Aim number 5, the impact that could be attributed to the intervention versus outliers. A post-test comparison design did eliminate many internal and external validity threats. However, there were still limitations, one of which was with our demographics. We were unbalanced by age, in which most participants were 30 years old or younger. 2 questions on the stigma scale were also mistranslated and resulted in more missed responses in both groups. Of note, there was a gender effect on the knowledge scale between the 2 groups. Also, there were political factors that may have contributed, such as the legalization of same-sex marriage in Ecuador at the time of the intervention. This intervention did show it was effective on a short-term basis, but remains to be determined if changes persist on a long-term impact scale. Aim number 6, feedback and recommendations. Participants requested even more information regarding sexual health and STDs, and they would also like more testimonial videos. Facilitators and participants both expressed that they would like more interventions held with various times and dates. Facilitators also wanted to exclude the information session that was held the day prior to increase attrition rates. In conclusion, this pilot intervention was effective in its goal of increasing HIV knowledge and decreasing HIV stigma on a short-term impact basis. Based on the findings analyzed this far, the pilot was effective, efficient, and cost-effective. There are many suggestions for change in the future, and further detail will be outlined in a full program evaluation report. Thank you so much for your time and interest in this project. We really appreciate it.